Alright guys, it's Dr. Muhammad. We are back with another public health sciences question. I'm going to give you about 15 seconds to read this one, and then we're going to go through it and find out the right answer. So the correct answer in this case was choice E, a sentinel event. Hopefully you got that right, but let's go through everything, break it down, and make sure we know why choice E was the correct answer. A hospital system is under investigation following a recent adverse outcome, so we know something bad happened. A 64-year-old male with a past medical history of hypertension, coronary artery disease, and diabetes was scheduled to have an amputation of the first toe on his right foot. The surgeon who performed the procedure instead amputated 3 toes from the right foot, so that's no good. Was supposed to be 1 toe on the right foot, got 3 toes amputated on the right foot. Not good at all. Root cause analysis determines that this event was easily preventable because an outpatient general surgeon evaluated the patient and clearly documented the medical necessity and type of procedure the patient would require. This event most appropriately represents which type of error. So just based on that last part of the stem, we know we're talking about public health sciences. In this case, we're talking about medical errors, and more specifically than that, the question is asking us if we can distinguish between the different types of medical errors. Kind of taking a 10,000-foot look at the question, this was a patient that was supposed to have 1 toe amputated on the right foot. The surgeon accidentally amputated 3 toes on the right foot, and root cause analysis showed that this was something that was easily preventable. So let's go through the answer choices right now and talk about why E is correct. Choice A, a latent error. Remember, this is when the worker makes an error that has the potential to cause harm to the patient. The physician, the nurse, the healthcare provider, whoever it is, makes an error that could cause harm to the patient later down the road, but is not causing harm in this moment. Remember, this is the accident that's waiting to happen. In this case, unfortunately, the error and the harm already happened, right? The surgery already happened, the patient already had the toes amputated. So for that reason alone, a latent error is not what is represented in this scenario. An example of a latent error would be something like that outpatient general surgeon documenting the incorrect thing, saying that it was a toe from the left foot or saying that it was a finger or something like that. That's not causing harm to the patient right here, right now in this moment, but that definitely has the potential to cause harm down the road. That would be an accident waiting to happen. That would be a latent error. Choice B, an active error. Remember, this is when the worker makes an error that causes immediate harm to the patient in real time. And that is kind of what happens in this scenario, right? The surgeon performs the surgery and accidentally amputates 3 toes. That is active error. The patient is immediately harmed. So there is a good potential of choice B being correct. I'm not going to cross it out just yet. We're going to come back to it and I'll show you why it's not the correct answer. Choice C, negligence. This is a trap again. Remember, this is something that we really didn't discuss too much in public health sciences, but this is determining what a reasonable physician would do or a reasonable healthcare provider would do. Interestingly, in this case, you could make the argument that there was some negligence here, right? The surgeon could have done a better job. He could have reviewed the documentation better and not amputated so many toes. So there is negligence potentially in this scenario. However, the question is asking us which type of error, and negligence is a legal precedent. It is not a type of error. So in this case, although it seems tempting, negligence is not the correct answer. And then choice D, a missed error. This isn't even technically one of the types of errors that we discussed. There was a near miss, which is an error that could potentially cause harm, has the potential to cause harm, but this isn't a near miss. This already happened. So it's not a missed error and it's not a near miss, so choice D is not the correct answer. And finally, choice E, a sentinel event. This is where things get a little bit tricky. Technically, the word error isn't in that, right? It's sentinel event. One of the things we talked about from the medical errors lecture was a never event. This is something that was easy to prevent, easy to identify, and it should not happen, but if it does happen, it has the potential to cause serious harm. And when it does happen, it's called a sentinel event. And in this case, this is something that was easy to prevent, right? The surgeon should have marked the foot or the surgeon should have reviewed the documentation. It's easy to prevent this from happening, but it did happen and it was a very serious outcome. The patient lost 3 toes because of it. So it was a sentinel event. However, we're left with choices B and E. We've narrowed it down to these two, and this is where we need to go back to the question stem. The key to answering this question is the fact that root cause analysis was performed and it was determined that this event was easily preventable. Remember that I said these never events, they should not occur, but when they do occur, it is a big deal, and there are often legal implications to this. And given that this is the first time this is occurring, it would be a sentinel event. The fact that it was easily preventable kind of rules that out as an answer choice, because not all active errors are easily preventable. However, all sentinel events are easily preventable, and that is why choice E, sentinel event, is the correct answer. That question was a little bit tougher. If you have any doubts, I recommend that you go back to the medical errors lecture and go through all of the different types of medical error again, but hopefully you got this one down, and I'll see you in the next one.